Drug-resistant tuberculosis. Hey there, today we will learn the basics about drug-resistant tuberculosis. But before going forward to drug-resistant tuberculosis, let's learn about tuberculosis. What is tuberculosis? Tuberculosis, or TB, is an airborne disease that primarily affects the lungs but can include the brain. Because TB primarily affects the lungs, respiratory systems, especially a cough that lasts more than 2 to 3 weeks, accompanied by fever, chills, night sweat, represent the most common manifestation of TB. TB is spread by a slow-growing bacterium named Mycobacterium tuberculosis, MTB in short, and related species collectively referred to as MTB complex. TB is most common in people who come in frequent or prolonged contact with a patient with a cough, and reside in countries where TB is common. People with certain medical condition that lower the body's immune response, such as HIV, AIDS, are at a higher risk of developing TB disease when exposed to a symptomatic TB patient. TB bacteria, also called tubercle bacilli, enters the lungs when someone is exposed to a TB patient as described. In its attempt to contain the infection, the body's immune system walls off the invading bacteria into what is called a granuloma. However, bacteria may continue to multiply and eventually break out of the granuloma, leading to early manifestations of the disease. Some bacilli may also enter the bloodstream and spread to other parts of the body and cause disease in these other parts of the body. Oftentimes, though, bacteria in the granulomas lay dormant until they wake up at some point in time, causing active TB disease even many years after the initial infection. When TB becomes active, it results in symptoms such as persistent cough, which typically lasting more than 3 weeks, unintended weight loss, fever and chills, fatigue or a feeling of tiredness, and night sweats. Today, TB is one of the leading causes of death from a single infectious agent worldwide, though cures exist for the disease. However, beginning with the first antibiotic treatment for TB in 1943, some strains of the TB bacteria developed resistance to the standard drugs through genetic changes, thus changing from original drug-sensitive to be drug-resistant tuberculosis. This brings us to the question, what is drug-resistant tuberculosis and how is it developed? Most cases of TB can be treated with a first-line treatment. Drug-resistant tuberculosis, or DRTB, occurs when tuberculosis no longer responds to at least one of these first-line medications. DRTB can occur when someone acquires TB from another drug-resistant TB patient. DRTB can also occur when a TB patient missed taking their prescribed medicines correctly or prematurely discontinues treatment, giving the bacteria a chance to grow back and become resistant towards the medicines. Treating this type of TB requires a combination of specialized treatments called second-line therapy, either short or long-course regimen depending upon the patient, and require full patient adherence to protect additional resistance, which can in turn be spread to others, including loved ones. Duration of treatment and regimen selection also depends on the type of DRTB diagnosis by individual patients. So, what are the different types of drug-resistant tuberculosis? Types of drug-resistant TB are classified based on the drugs that they do not respond to. Today, DRTB is divided into 4 main categories based on drug resistance profile, namely rifampicin resistance, RR, multi-drug resistance, MDR, pre-extensively drug-resistant, pre-XDR, and extensively drug-resistant, XDR, TB. Different classification requires full resistant diagnosis tests. Identification of DRTB type is very important to select appropriate treatment and care. Insufficient and inappropriate regimen selection can reduce an overall treatment success. Once patients recognize their signs and symptoms, patients should be aware of the urgency of seeking medical attention to get proper diagnosis and treatment. This is to ensure patients get the right treatment at the right time for themselves and protect their loved ones by reducing an overall transmission of DRTB. In the next video, you can see the patient journey of DRTB care.